Over the past few days in Nebraska, the term herd immunity has been thrown out as an option to dealing with the pandemic. You may have thought, what is herd immunity and how does it work? We sent reporter Phil Bergman out to uncover what it really means.
Herd immunity is the latest addition to our coronavirus vocabulary list. But what is it?
Herd immunity is the idea that if you have a large group of people and you release the infection into the large group, a large proportion get sick, right? And as they get sick, we presume they have immunity.
Dr. Kelly Calkett is a physician at Nebraska Medicine. She spoke about the topic on Facebook Live this afternoon.
So when the virus is continuing to spread, eventually it gets harder to jump from person to person because you assume that you have immunity throughout the herd at a point at which it's not easy to find the next person who hasn't been infected.
A goal of herd immunity is to protect those who are most vulnerable, such as the elderly and young children. To show how it could possibly look, here are a bunch of cups. This is our population. Those who are at risk will put over here. They're now in isolation. In this example, the blue Gatorade is going to be the coronavirus. In herd immunity, people would need to contract the virus and then recover. If they recover, they'll get the antibodies and have the immunity. However, while you're developing this herd immunity, people are still getting infected and some may die. The Johns Hopkins School of Public Health estimates that if 70 to 90% of the population have the virus, then herd immunity is in effect, meaning those in isolation can come back into the public. If, say, a new round of the virus comes along, it would be tough for it to spread because there's liquid in all these cups already. Although scientists believe the immunity to be permanent, no one knows for sure yet if this is true.
If you don't generate good immunity, herd immunity doesn't work. If this isn't a durable immune response, which is something that's in question, they just make people sick but doesn't guarantee that they don't get it again.
Calkett says herd immunity in Nebraska could cause the healthcare systems to overrun and have a peak that is larger than she wants. She is not advocating for the idea of employing herd immunity.
We don't know if it's going to work, and if we try it and everybody gets sick, we're still struggling with the same problems we've been talking about the whole time.
Reporting in Omaha, Phil Bergman, 3 News Now.
The term herd immunity is usually referred to when talking about vaccines and the benefits of vaccination.